We all know that walking is good for us, but does it matter how we get those steps in? Is it better to take one long, continuous walk, or do all those little short bursts throughout the day add up to the same thing? For a while, the science on this wasn't totally clear, but today we're going to dive into a major new study that gives us a pretty definitive answer.
For years, the conversation has really just been about one thing: hitting a certain number of steps. But what if the pattern of our walking, the way we structure it, is actually a much bigger deal for our long-term health? Well, a new study published in the Annals of Internal Medicine has an answer, and it might surprise you.
But before we can even get into what the study found, we have to talk about the most famous number in walking, that 10,000 step goal. Where did that number actually come from?
Now, most of us probably assume that this number is the result of some serious medical research, right? A scientifically proven target for being healthy. The reality, though, is a little different.
It turns out the 10,000 step goal wasn't a clinical recommendation at all. It was actually a marketing slogan from the 1960s for a Japanese pedometer. It was catchy, for sure, but it wasn't based on hard science. And that's really important to remember because it shows why we have to scientifically test these popular health ideas, which is exactly what this new research is all about. So let's move past just the total number of steps and get to the core scientific question here. Does the pattern of our movement really matter? The researchers basically sorted walking into two main categories. First, you've got your short, interrupted walks. The kind of steps you get just moving around the house or walking from your desk to the kitchen. Then you have long, continuous walks, which they defined as walking for 15 minutes or more without stopping. So the big question for the study was simple: which one of these is better for our health? To figure this out, scientists analyzed data from a really big long-term health study, which gives their conclusions a very strong foundation. So they used the UK Biobank database and tracked over 33,000 people for almost 10 years. The average age was 62. Now here's a key detail. They focused on a group that was relatively inactive, people taking fewer than 8,000 steps a day, and all of them were free from cardiovascular disease and cancer when the study started. This method gives us a much cleaner look at how walking patterns can influence health, especially in a group that has the most to gain. After following this huge group for nearly a decade, a very clear pattern started to emerge from the data, linking people's walking habits directly to their health outcomes. The findings were pretty crystal clear. This chart shows the risk for things like mortality and heart problems based on walking patterns. Look at the bar on the right. Those are the people who got their steps from long, continuous walks. They had the lowest risk. Now look all the way to the left. The people who got their steps almost entirely in short little bursts had the highest risk. That is a significant difference. The study's official conclusion puts it bluntly. The way you accumulate your steps seems to be a critical factor. Those very short periods of movement were associated with much worse health outcomes compared to the longer, more sustained walks. Okay, now for a really important piece of scientific context. This study shows a very strong correlation or link, but it doesn't prove cause and effect. The researchers themselves say that other lifestyle factors could be involved. For instance, people who take longer walks might also have other healthier habits. Still, when you see an association this strong, it's a powerful signal. So how long you walk for is one part of the equation. But the research also points to another crucial factor that affects the health benefits you get from walking: its intensity. The most beneficial walking pace is what we call medium intensity. There's a super simple way to know if you're in that zone. It's called the talk test. Basically, you're at a medium intensity if your heart rate is up and you're breathing deeper, but you can still talk in sentences. If you could easily sing a song, you're going too slow. If you're too out of breath to chat, you're probably going too fast. And walking at that brisk, medium intensity pace has some very specific benefits. It challenges your cardiovascular system more effectively, which leads to better circulation, lower blood pressure, and positive changes in your metabolism. To put it simply, a faster pace turns your walk into a much more effective workout for your heart. So, what do we do with all this? How can we take these scientific findings and actually apply them to our own daily lives? Well, the key takeaways are pretty straightforward. First, try to make your walks continuous. Aim for at least 1 or 2 walks of 15 minutes or more each day. Second, pick up the pace. Get yourself into that medium intensity zone where you can talk but not sing. And third, maybe the biggest shift, is to start thinking quality over quantity. How you walk can be much more important than just how many steps you take. And this focus on quality might even mean you can lower your step goal. Other research has suggested that around 7,000 quality steps, taken in brisk, continuous walks, can provide huge health benefits. So not only is that a more achievable target than 10,000, but this new data suggests it's a more effective one too.
Ultimately, this research really asks us to rethink our approach to one of the most basic forms of exercise. The question is no longer just, how many steps did I take, but how did I take them? Are your steps just a number climbing on a screen, or are they a purposeful, real investment in your long-term health?